All right, hello everyone, and thank you so much for joining us. This is Georgie Carter from the Health Policy Plus project. I am delighted to welcome you to today's online policy forum entitled Building Digital Solutions for Health in Guatemala. We have a great discussion lined up for you today, and we'll begin with just a few announcements. The session is being recorded, and we will post the recording to the Health Policy Plus website. Now, we would love to hear from you, and we welcome your questions at any time. Please submit your questions via the chat box on the right side of your screen, and our moderator will read them aloud when we pause for questions. Now, these web conferencing platforms are getting a high volume of traffic these days, so we ask that you bear with us just in case there are any glitches with the technology. Now, this webinar will be conducted in Spanish, but with live English interpretation. On the bottom left corner of your screen, where it says floor, you can click now to select your preferred language to listen to the webinar, English or Spanish. If you have any issues with the language, please use the tech support channel in the chat and we can help you out. Please also note that the English version of the slides have been uploaded to the documents on the right-hand side of your screen. Given that the slides presented will be in Spanish, you can follow along with the English versions as well. That concludes our announcements portion, and it is my pleasure to hand it over to my colleague, Andres Navarro, the Information System Manager for the Health and Education Plus Policy Project in Guatemala. Andres?
Muchas gracias, Georgie. Muy buenos días a todos.
Everyone. Welcome to the webinar, Building Digital Solutions for Health in Guatemala. My name is Andres Bravo, Information System Manager of the Health Policy and Education Plus project in Guatemala. And I am pleased to introduce our guests and panelists. We are joined by Armenia Reyes of the HEP Plus Guatemala project, Dr. Ima Alfaro of USAID, Dr. Karem Morales of the National Reproductive Health Program, Claudia Maselli of the Human Rights Office, and Engineer Márgareth Espinoza of the Health Management Information System and Ministry of Health. I would like to share the agenda of this webinar, which will start with an introduction about the work of the HEAL Plus project in Guatemala, and then present the methodology used for the development of the different digital products in the joint work with the organizations. Then we will have the pleasure to meet our panelists who will talk about the digital solutions of their organizations that have been developed in conjunction with the Health Plus project. And then we can initiate a space for discussion around these digital solutions. At the end of this webinar, we will have a space dedicated to answer questions that we will receive through the message board, and then we can conclude the webinar. Beginning with the agenda, I would like to welcome and give the floor to Mrs. Armenia Reyes for the introduction. Good morning, Mrs. Reyes. Good morning, Andres, and good morning, everybody. I'm Armenia Reyes, and I appreciate everybody of you who are here. I'm the director of HP Plus. I begin my participation remembering of the HPP mandate is to improve the service of health in sustainable manner and implementing policies with voluntary programs. The focus of our work includes family planning, sexual reproductive, maternal reproductive, and development of health. This program is based on 4 objectives. The first one is based on policies and best practices. The second one is to improve the policy of the government. Our objective is to, and the fourth one is to enforce the civil society and government. In order to get this objective, the first one is to enforce policies for the health service. The second one is governance And in this one is where we will focus today. And the first one is a response as a project that we have to COVID-19. I would like to mention that in the last years, we have gathered with our partners in order to get some results. I will focus on some results. We contribute with our partners. One of our results is that I would like to mention is the concept of the implementation of health services, the modification of the civil code of our country in order to enforce that not child marriages are done. Also, we implement the reproductive health policies is enforced. We work with the enforcement of capabilities of multisectoral organizations. Also, information technology, and also to contribute the design and implementation of a national plan for COVID-19. And in that same plan, we are also working in the training for health providers for the prevention treatment for COVID-19. And in the last days, we have gained the design and development of an important tool for the health system. These are for the health services in Guatemala. But now we're going to talk about what this webinar is about. HEP Plus recognizes the essential of the technology can have in the development of the system. So HPP integrates data in everything we almost do, like with partners, like with the Ministry of Education and the Human Rights Office, and we are collaborating for tools and technology for the improvements in decision making. As you may know, you know 3 of these tools. And now I will pass the microphone to Dr. Ima Alfaro. So now I welcome her. Good morning. I'm Dr. Karem, responsible of family planning in the National Program of Health, the National Reproductive Health Program. I'm also the health project management specialist in the Armenia Reyes country director, engineer Andres Bravo of HIP Plus. For me, it's an honor to be with you, representing the United States Agency for International Development, USAID. Between its line of cooperation, USAID provides assistance for digital tools in this online webinar. So this is for communities and for the country. We also promote the use of open digital ecosystems, inclusive and secure, that protects the rights of people and benefits all its citizens, especially the most vulnerable ones. The correct use of technology is imperative for the development. In Guatemala, USAID works with the Ministry of Health to improve the quality and health of the population. We also work with the Human Rights Office, promoting methodologies and tools that support the exercise of the human rights. We also support multi-sector entities like the National Contraceptive Security Commission that also works for the use of contraceptive and services for family planning. And also they contribute the improvements for which the information is fundamental. When we work with counterparts like the indigenous women for health, education, and nutrition, we improve their abilities in dialogues and health policies. So by monitoring the whole system and obeying the lane for health monitoring, now this monitoring is done in coordination with the Human Rights Office, with the reproductive health program, and contraceptives are used for family planning, so making easy the information for these people, the services, and the impact of this in maternal and child health. And with the health ministry, we support the improvement of sustainability and technological programs. So this is done by data analysis. So today in this webinar, we have the opportunity to know the methodology used for the innovative tools programs and the impact of creating digital tools for the health system. I thank Dr. Morales, Karem Morales, and Claudia Maselli for this information for the webinar. I also thank the organizations that make possible for these tools, the Human Rights Office, the Ministry of Health, the Guatemala Institute of Social Security. We congratulate them and also the interest that they make in making these tools to registry and information analysis to make evidence-based decision making. Also thank Palladium and the Proctor of USAID in the assistance that they bring working together to provide these digital tools that support the needs. So also I congratulate all the participants that with the knowledge we can move in the governability and productivity in Guatemala. Thank you very much. Thank you very much, Ima Alfaro. So now we go back to the presentation and we talk about the digital solutions development methodology. During our years of experience, we have addressed several products and services, developed solutions depending on the information needs and the use of the data presented. Our methodology is suited not only to information systems, but also to projects for the development and management of knowledge bases, and to provide technical assistance to specific needs of institutions. Our development methodology addresses the basic stages of the information systems lifecycle, starting with the conceptual stage, analysis and design, development and delivery or release of the product. This product requires being accompanied by the technical and technological teams of the institutions, and thus, from the first stage of conceptualization, we seek to jointly answer questions such as what will be the objective of the solution, in what context will the solution to be developed be used, is there a specific audience for the solution, and if so, what is the best way to reach that audience? And perhaps the most important question to ask is, depending on the product to be developed, is what decisions can be made with the support of the tool to be developed. In order to obtain these answers, we jointly conducted conceptualization workshops, technical meetings, and work tables to obtain a clarity and the best input to advance the next stage. The requirements are analyzed, the necessary basic functions are defined, and the design of the solution can begin. At this point, when we are ready to approach the development stage is where our methodology allows us to identify and adapt to the use of other standardized development models, since it is necessary to adapt to the characteristics of each product and to the work with the different solutions. Sometimes, in order to strengthen the solutions, new requirements and inputs are presented, or interested parties are added to provide new contributions, allowing us to broaden the scope of the solution and making it integral to meet the needs of the institution. So how do we handle possible changes to adapt these new resources? Depending on the type of solution to be developed, we define iterative or versions or incremental or phases cycles. In this example that we can see there's a version that contains the functionalities of previous versions, but each one replaces the previous one until the final version is reached. This is the development iteration. Another scenario is when the contributions or new actors that are incorporated to the project provide the inputs to extend the services and results from an original solution. In this case, the cycle becomes incremental, and here the methodology seeks to establish phases for the development of its solution. And this is done through modules that interact with each other, but which are independent in their operation and that can meet the needs of the institution as a comprehensive solution, like a system. The example refers to a solution that can start with the capture of information, but that process information can support the activities of other areas, and will also provide decision-making tools for the authorities. For the decision-making. All these conform a system with the capacity to continue with the needs of the solution. With each project that is developed, our methodology becomes more efficient, since this is efficient with each one experience. And this is done because in each of one, we improve our capability. And this can be done through the documentation of the entire process, of each cycle and of each phase. Of course, all this documentation is always built together with the technical and technological teams of the organization, who at the end receive the tools in operation, that not only receive the source files and technical training, all backed, of course, by the technical documentation and manuals that together provide the institutional knowledge base for the sustainable and scalability of digital. Now, I would like to give space for our panelists who will meet next, and they will tell us about some of the digital solutions that we have worked on together with organizations. I begin with Dr. Karem Morales from the Ministry of Health, to whom I give the microphone. Dr. Morales, welcome.
We have a module for the analysis in which information is processed and allows to view and present information in several boxes of control.
And in the last one, that here you can see basically data that could impact decisions, right? That, for example, how we can contribute family planning to reduce maternal death, unplanned pregnancies, child deaths, and healthcare cost savings. So this was done in a commission to favor.
Muchísimas gracias, doctora Morales. A continuación.
Thank you very much, Dr. Morales. Now we will go to Licenciada Maselli. Good morning. Welcome. Thank you very much, Engineer. Cheers to all the panelists that are joining us. The Human Rights Office uses the tools for monitoring to assist the mandate of government to protect the human rights and the education rights for the people. We have addressed different variables in the platforms that show data and results from the monitoring done, along with civil information to defend the rights to education, food, the 1,000-day window, and the health of mothers and children. This is used for the decision-making at the government level, and so that there is social audits in different territories. These tools contain a control panel classified by topics addressed per territories, where the data have been collected. There are different variables: infrastructure, staff, and as of 2020, with the pandemic, we have involved the variable dedicated to COVID to establish the conditions of the staff of the first line and second lines of assistance. Thank you very much for the possibility to present these two platforms. Thank you very much to you, Licenciada Maselli. And we continue with Engineer Márgareth Espinoza from the Ministry of Health. Good morning. You have the chance to talk. Good morning. Thank you very much to all of you. It's a pleasure for me to be here representing the Ministry of Health it's very important to present how much we have advanced this year, which has been very critical regarding vaccination. We have started the year, CICSA has started the year with a challenge of vaccinating the population, because we've been always assisting people within the ministry, but right now with the vaccination, our population, our target population is about 10 million and a half people over 18 years of age. We have created a site with all the people who want to be vaccinated, and this site has to comply with all the stages of vaccination and the requirements it involves. We have received the assistance of USAID with the HP Plus program, which has helped us cover the demand. So now we have a special section in our site that has the possibility to attend this need. We also have a network to distribute the content from our website. There are days where there is too much demand. For example, those days when we enable the site for more people. For example, when we enabled it for people over the age of 40, and there are too many visits to the site. People who want to register, people who want to access the site and see if their range of age is already available for vaccination. These special dates, the traffic to the site is very high. The demand goes up. So thanks to USAID, conjunctly, we've been able to maintain the site online. We haven't had any issues due to the demand of people using the site. So we appreciate the technical assistance from USAID. So we will continue to work as a team to face the challenges that CICSA finds. One of them is vaccination, which has progressed little by little. We have other challenges we have to address, and we have a project to address it together as a team. And this is something we appreciate very much from USAID. Thank you very much, Andres. Thank you, engineer. Thanks for your presentation. Now I would like to address the next point of our agenda, that is the debate table, where we can discuss a little bit what we've been talking about these last few minutes. We are offering information to different types of audiences, and we know that information technologies are related to the right of access to health information. What is the relationship? Information technologies are very closely related to the right of access to public information, which is a needed right to access other rights, so that people can make decisions based on information, data, and evidence, not only at the level of government decision-making, but also it's a right for citizens as a way of social audit to the state. They are an opportunity to develop information platforms that provide data for decision-making, that also allow the design of public policy and also the design of statistics. In this case, the development of platforms for the right of eating, for the right of education, a right for all populations, as Irma said and recognized in her valuable work.
Realizado en puestos y centros de salud y establecimientos educativos, presentándose como un recurso para las lideresas, también para su auditoría social.
It is also very important to understand that technologies, digital solutions, need to be flexible enough to add new variables, as is the case of COVID-19. And it is also very important that the tools do not represent an advance in itself, but it is also important that they are accessible and that they are up to date. It corresponds to the state to count with information that is up to date, to make decisions, and also to design public policy. Thank you very much, Engineer Bravo. We can also add more during the time of questions and answers.
Ingeniero, no se le escucha.
Disculpen la molestia, disculpen la interrupción.
Apologies for the interruption. I was saying that it's very important what Licenciada Maselli said, and it is also very important the work that is done in the Contraceptives Commission, because they work with platforms that publish information, open information, and they also work in an interinstitutional way. How is that work represented with this tool in the Commission? Thank you. I believe the question also allows to discuss the path we had to walk in the development of this tool. I agree with Licenciada Maselli that eventually the information that we integrate in this tool was visible, was analyzed, was in paper. That is not the best condition to evaluate information or data. And there was too much time passing before decisions were made. The impact of this tool is the consolidation of a process that was developed and validated and was agreed upon with different organizations. For us as a commission, it has been a very big achievement to agree on the indicators that will be measured, on being able to define the way in which this data would be published, and also to define a mechanism for the monitoring and the entering of the data that will be on the tool, and also to be able to bond as institutions with the same objective, that is to count with information that is timely for the decision making for each organization, and also at the national level. There are many benefits in such an aspect, in an aspect that is such simple as family planning. We've been able to group together very big organizations that are working on this area, relate data that can give us information, has also allowed us to present ourselves to higher authorities We have presented this to the Congress of the Republic, and that shows us that our work has sense, makes sense, and is worth it at the national level. I would also like to comment that we've observed
Realmente es un trabajo que apoya a las instituciones y en ese sentido.
So in that situation, I would like to ask Mrs. Espinoza, and that support that you receive from digital solutions for the population, how do you obtain, how do you improve the services from the Ministry of Health? Thank you, Andres. Actually, one of the pillars to improve the health system is to have an information system that allows to fasten the processes, right? So recently we have worked in conjunction with your team, Andres, in order to improve the information systems. And we know that as a technological team, our function is to improve the information system, thus improving the care that the citizens receive when they go to a health institution. And as I said before, the challenge for the Ministry of Health is big because the services that they provide are huge in the hospital, in the care system. Our population, our target is from different ages, from among all ethnic groups. We have to provide our services in all the country, and of course there are technological challenges from the teams to the connectivity in faraway places compared to other sectors. And we have to go to the faraway place, to the faraway sector, and there is where all the challenges we have, how we can get all the technological challenges and to the technological access for these people. And in the last years, we have changed the technological system. What 10 years ago was functional, now it needed a change, a renewal that can just be more easy and accessible to these people and to these people that don't have connectivity. But if we can get a technological system where we can have all the tracking, the interactions and everything that the person can do with the whole system, I think is one of my personal dream, what I would like to see in the Ministry of Health when we have to enter the number of the person, whether this person is hospitalized, how many times he goes to a hospital, to a center. I would like to get to the point where I can see and do everything as a person in a hospital, in a health system. So that could be with all the partnerships, and I know that all want to cooperate and support, but all we need to do is to just focus on what we really need. Thank you. That's excellent. Yes, and it's really important to know how these tools are supported in order to get the needs as an institution. It's excellent how these organizations are beneficial, how a tool is so essential in order to provide this information. I would like to ask Mrs. Maselli how you supported all these tools for the Office of Human Rights. Thank you very much. With the systematization of the monitoring results based on the Human Rights Office, so besides facilitating all the aspects that need improvement, as we have observed, we also wait that we can get help to have a graphical reference. The link to the platforms has been used as a reference to information and data included in the Office of Human Rights that they present every year to the Republic. And there's an inspiration in the development of these two platforms that search from the opportunity that could be tools that could be used for places where this monitoring can be done for the rights to access to the information, but also the participation to improve these services in their communities. Of course, securing the challenge of the gap between the connectivity, internet, and the basic needs for these territories. For us, the U.S. Health Palliarium has been really beneficial to the institution. They have helped with the innovation aspect for the human rights, but they have technically done, professionally done, but also respectfully done for the needs as an institution. What you have mentioned of the different moments in order to get to the platform has been a really rich moment, because also it has improved the partnership between the groups, but also the respect for the institution has been really valued, because you not only respect the institution, but also the independence of the institution. Also, we have to thank this opportunity to receive your support and Palladiums, because this is thanks to this alliance that has been done with all the leaderships, which has also seen that has really been of a really help, so that we can also see this in this platform, and we can see the results of this monitoring, and we hope that this help them. For us, it's of vital importance in order to publish the results of the work done, and we hope the capabilities of the institution, as you may know, are limited, especially in the reduction of budgets that which was established for many years as a limited budget. So the support from that technical assistance has been very valuable for all of us in the team. Thank you very much. Thank you very much, Ms. Maselli. And it's true that the methodology, as I explained, needs a partnership from the very onset in order to understand the dynamic of the institution work, in order to understand how this should be addressed, and not to have any problem with the institution work. And obviously, the team that will use the tools. And in that sense, I should recognize that the National Contraceptive Security Commission has been very helpful. It has been very helpful because it's a commission. The methodology has to adapt to that space that exists in the commission. And I would like that Dr. Morales could tell us about the experience of work in the interinstitutional. Yes, thank you. As I mentioned before, the commission is really particular, and thanks to these experiences, but the commission in Guatemala establishes what has been established, really brings a also, I would like to say that in this work, there are institutions that back the work that has been done in this commission, and that has been supported. And of course, behind that, there is some people that have the role to enter the information, to down information, to analyze information, and all this has allowed a commission to be organized in order to do this. Personally, as I mentioned before, on the onset of the work, the indicators that we asked as a commission, and I was there, and it was a very difficult experience because the institutions has, there's one person who is in charge, and then this person changes, and over time this is changed, and we have to try to involve all these people that had taken part in the commission with different roles. We had different meetings. So basically, since all that information were established, in order to transfer all that information to this monitoring, although it was a hard work, this is like a future excellent, because now we can all see what we have contributed nationally. I'm talking about all the efforts that was done from the country. We can see that everything was done. We can see that all the contributions was done, and now we can see it. And this can be an accomplishment from a personal perspective, and also from the national perspective. And this is like a regular coordination, systematic coordination, and now we can obtain this information, not only abate it, because we have to push all the institutions to see who will be the first, who is missing some data. And so that turns into a regular commitment in order to be up to date with the information, so we can visualize all that we do in the same platform. Thank you very much. Thank you, Doctor. And as we have mentioned in the support, something important in the Ministry of Health is to take these solutions to the population, to provide these platforms so that the services can be improved, the services in the health system. This is done through SIGSA. Engineer Márgareth, I would like to ask, how did you do in order to get to the population so that the services can?
Efecto, pues.
Ways to get to the population right now is through connectivity. We were commenting about it a moment ago. One of the resources as an engineer in systems, we have to maintain the site because we have many attacks from people who want to play around as hackers and start interacting with the platform with the aim of ruining the site, so that they have then the pride of having defeated the Ministry of Health website. And then we have other types of attack that have the actual intention of attacking. We can't not take those into account. So our objective with the vaccination is to maintain the website in shape all the time, working fine. We've seen many sites of other countries falling down, and that made me worried, because I was thinking, how will we manage with our website? How will we help our population get vaccinated? Nevertheless, with your help, Engineer Bravo and Armenia, we've been able to maintain our site. And something I want to highlight, as Licenciada Maselli said, is that you've been very respectful of our organization, and that allowed us to work as a team so that the rest of the institution does not perceive that you come here to take over our work or taking care of things that are our responsibility. They've seen that you're here to support us and to move forward with our technological challenges that are many. When I heard Dr. Karem, I thought she has a little piece of a whole world that is the Ministry of Health. The Ministry of Health is huge. At the level of ministries in Guatemala, I can assure that it's the biggest one, because all the other ministries attend smaller populations, but the Ministry of Health has to provide services to every single person. No matter if they're identified or not, they need to provide services to everyone. I think this is the year of change, of reform, and we have to take advantage of it, to make technological advances, and we need your support so that we can implement that change and we can provide a new service to our population, as Dr. Karem said, and to all the other members of the ministry that demand for help. That is the intervention we need to make. Thank you very much. Thank you very much for this debate space. We already have some questions and comments made by the audience participating in this webinar. I would like to respond as a team to these questions. There is one to the whole panel. The question is, are qualitative indicators included in the tools? The microphone is open to all of you so that you can mention which are the qualitative indicators that are included in these tools. We work with indicators, as I said in the brief presentation, because if one wanted to navigate the tool, there are other ways and possibilities to visualize it. But we have indicators in terms of budget, financial resources that are available for reproductive health. And we also have indicators of results that are basically the visits we get, the appointments for family planning, and handling the delivery of contraceptives, and the assessment that is given to couples in regards to the contraceptives use, and the decision of the people using contraceptives. That is one of the indicators that we captivate in the tool, in the monitoring system. So each part of the tool has several indicators that we will be monitoring that are part of the quality in family planning. Excellent. There is another interesting question also related to indicators, and they ask if indicators include the participation of population. In which way do they do that? Maybe I would ask Licenciada Maselli about this. You can answer this question. Do indicators include participation of population, and how do they do that? Absolutely, definitely. One of the reasons, the motivations of the office is how from the institution to make more evident the right that population have to participation, also as a principle of the human rights. So as of several years ago, we provide a platform that involves exchange and cooperation. This is an instrument of politics that has allowed us to work together with other leaders. Part of monitorings each year has different times to establish a schedule, to define different stages that indicate not only the sampling of the services that will be monitored, but also how that will be done, exchanging and working together on the samples, and also the paperwork that is used to define indicators. Coming back to the previous questions, it's very important to carefully define the variables and indicators. For example, the infrastructure of basic services during pandemic time has so much resonance. It is so important, but we're also talking about health centers. In the case of health centers that have running water and places to wash their hands in the area of medical assistance. There are other indicators, for example, if they have electricity, computing systems, internet service, sanitary services. Those are things that are basic, but some leaders consider them necessary because some of them don't even count with all of them. So this monitoring are in full respect of your view, your point of view as leaders. Thank you very much. We have many questions, but unfortunately we have come to the end of our webinar. I would like to say that we will be answering all the questions that have been made to us. We will be answering them and we will be posting them so that none of them is left unattended. I would like to say it's been a pleasure to share this webinar with all of you. I would like to say thank you to the audience, to the panelists, to the organization, to the Office of Human Rights, to the Ministry of Health. Thank you very much for being today with us, discussing all these topics that are so important. Digital solutions are surely to be developed more in the future. We will discuss further in the future, and we will be working together to make it more efficient. To Palladium, I would also like to thank you for cooperating in this webinar and to providing us with this platform. Thank you very much to all of you. My name is Andrea.